Hi friends. So this is about a quick revision for cystic fibrosis part 3 mass registration. A lady came for pre-pregnancy counseling and she's having a cystic fibrosis affected baby. Okay. So just remember this story. So you are not going to miss any of the points that we have to say specifically in cystic fibrosis, and rest the history same as like all others. Okay, so just remember this story. So you see, you want your baby has to diagnose. You want the baby to be diagnosed. So for diagnosis of your baby, what you need is the doctor told you that you and your partner need genetic testing. Okay, and so with the family records, you are going in a auto to meet a genetist. It was a risky travel in an auto. So you reached the genetist. Genetist told you about the type of variants, the outcome. So you got so depressed. And so what happened? So depressed. You bought some contraceptives and thought, I'm not going to become pregnant for some time. So meantime, this time what you did is you took care of your baby very well with the help of a team of doctors, vaccinated your baby to protect baby from infections. So you got little bit okay. Now you thought of a second pregnancy. So you started taking folic acid 3 months prior, and you checked your rubella immunity as well. So now you thought you will go and take the options to have a healthy baby. So what you did, you are referred to a special fertility center where you were discussed about the pre-implantation genetic counseling and a test tube baby and implanting defective gene-free embryo. Thus, you can have a healthy baby. You're so happy. So, and they told about the option in the pregnancy. By the end of the 3rd month, you will be referred to a fetal medicine unit where a needle testing will be offered to you, which has got, though it's a straightforward procedure, it has got a 1 in 100 chance of miscarriage and 1 in 1000 chance of a infection rate. So overall, you felt happy. You took the written information leaflets, and your things was documented, and you returned. So that's the story. So I will explain once more. So your baby want to diagnose. Baby means you want to ask how is your baby doing, how is your baby now doing, and diagnose means you can ask how is your baby diagnosed. So she will be telling maybe by routine screening after the birth of the baby it was diagnosed, like that she may be giving the answer. And you and your partner, so we can ask how is your partner doing, is he having any disease, whether you and your partner have done the genetic testing. So that is the one. And with the family records means family history. Family means family history. Records means 3 things you have to remember: rubella, ethnicity, contraception. To remember that, I just of the record, REC. Okay. Now then in a auto you reach the you are going to meet the genetist. Okay, so genetist means it is a genetic condition. It can affect our organs, lungs, and also organs like gut. It can cause jaundice. It can affect the future fertility sometimes, and I'm sorry to tell that sometimes this can affect the lifespan of the baby as well. I'm sorry to tell this, but I need to inform you. Okay, so like that we can tell. Then we can tell about it is a autosomal. Auto means autosomal recessive condition. Okay, to get that, I opted the autosomal recessive condition. So we can tell her that the defective gene, each one from one of your from parents has to get, then only baby will have disease. So since you are having one defective gene, that is why you are carrier, and the baby is having the disease, that means baby is having two defective genes. So it is obvious that your partner is also having one defective gene since he is not having the disease. So actually it's not needed to test the partner, but I need to confirm one thing here. It's important here. I want to know if your current partner is the biological child of your biological father of your child. Is it? That we can ask. Okay. Then auto means we have to remember autosomal recessive. Then risky means risk of transmission. That is, how is that risk of transmission to the future child? So we can say 25% will have disease, 50% will be carrier having one defective gene, and the rest 25% will have no disease, no, will be normal. That is the risky. Then genetist, then we will be referring you to the genetist who will be discussing you about the type of the variant you are having and the outcome. Then I can understand that this is affecting you and your partner very much. How are you coping with that? Do you want, if you want, we can connect you with the counselors and the support groups as well. Okay, that we can tell here. Or later on also you can tell, just not to forget I included here. Then about the contraception that we have to say. So meanwhile, till you are planning to have your baby, you can use a reliable contraception. For that we will be referring you to a contraceptive clinic. And I must tell you that whatever contraception you are using, condom is the only contraception that can prevent sexually transmitted infections. So that we can tell to her. Then so during this time the baby your baby need to be take care by a group of doctors and has to be vaccinated. So if you're okay to have your second baby, prior to that, at least 3 months prior, you start your folic acid, check your rubella immunity as well. And you can, the options for you to have a healthy child is, one is we'll be referring you to a fertility center where they will be discussing you about the pre-implantation genetic counseling, where you can have a test tube baby by taking your egg and your partner's sperm, and will be embryo will be produced outside, and the defective gene free embryo will be transferred to your womb. So thus you can have a baby without the disease. And another option is after getting pregnant, by the end of the 3rd month you can have needle testing by referring you to a fetal medicine unit, where after numbing a needle will be inserted through the tummy to the womb, and and some cells will be collected that will be sent for the genetic testing. And depending upon that, it will be decided. And it has though it's a straightforward procedure, 1 in 100 risk of miscarriage and 1 in 1000 risk of infection. And if the baby is coming as positive, we will be offering you another option of termination as well, like that we can tell. Then we can discuss her about at this moment also we can discuss her about the support groups, counselor facilities. Going through this can be difficult. We can offer you that. The written information, documentation, if you wish, will book a consultation with my consultant as well. Do you have any further questions? Thank you for your time.